use an athlete that you've worked with to help us illustrate, not a deep dive into a full case study. We may get to that down the road. But do you think of anybody right now that's just a good example of how you've utilized both systems or this GOATA system?
Okay, and I'll break it down. So, yeah, I've had the I guess privilege, if you want to say it that way, of working with a few pro athletes in here. So I'll talk about an NBA player with a hamstring strain. Right, that's very common. Tim Hewitt would say, in his terminology, and he's looking at that person moving, that maybe he's ligament dominant, maybe he's dominant on one side versus the other, maybe he's quad dominant or anterior chain dominant. Mm-hmm. So we're looking for the same things, but my MDT brain is going, is this a hamstring strain? And I'm always in here saying it's not a hammy until I tell you it's a hammy, right? Because how often is it, if we can thoroughly screen the spine, that really what it is, it's just a referral of symptoms.
Okay.
Right. And sorry about that. I'll turn that off. But anyways, yeah. And if I do my MDT assessment and on this patient as well, there were mechanical baselines that led me to believe that this is truly a spinal component.
Okay.
So, yeah.
Yep.
Did I go off?
Yeah, no. So talk us through a little bit. Was that particular NBA athlete with a hamstring complaint? Was that referring from the spine? And if so, how did you address it? If it wasn't,
in
where
this
did that lead
case,
you?
yes. And I would say in the majority of the cases of the athletes I see in here, the answer is yes, because they've had traditional PT or worked with trainers in their respective sporting venues or whatever. Yeah. So they've been working the hamstring to death, literally. They've been treating just the hamstring and he's not getting better. And they're leaving so much on the table, right?
So you found that there was a spinal component and you addressed that, and that resolved the hamstring symptom.
Yes.
Okay.
But it also restore other baselines too, right? Because I'm looking at mechanical baselines, I'm looking for strength, inhibition of strength, number one. That's huge in an athletic population, right? That's that they can get buy-in with.
Mm-hmm. And then, and how describe a touch on how you utilize these GOATA thought processes with that particular NBA athlete.
Well, one, when they walk in the door and I can see them in their front chain or anterior chain dominance, then I can drive that point home with them that this is the reason that this is occurring, right? Mm-hmm. If it's a derangement, then I need to add in what is the reductive force for this derangement, right? Mm-hmm. So sometimes it is end range extension. I have to put them in the front chain to get them back into the back chain, right? Because we know it blocks motion at that segment. Mm-hmm. And most of the time it's in more than one direction, correct? Right? Mm-hmm. So I can use the terminology that he's familiar with out in the gym and use it in my practice too. Now, if he comes in and he's not in this case, but he's inside ankle bone low, what we said, or he's got where he's going into pronation, mm-hmm. right? We know that that's a disastrous effect up the chain. Could be when you're a forward look motion athlete. Then I get to address that as well. Okay. But in this case, it's more of front chain dominance, right?
Hear the entire episode for free on iTunes, Spotify, other favorite podcast players, or go to mechanicalcareforum.com.